Hey guys, welcome back to my channel. If you're new here, my name is Dr. Maushmi Das and here I am today to continue my series on anatomy of larynx. Now so far in my first video, I've spoken about the parts of larynx, the extent of larynx, the lymphatic drainage and the blood supply. In my second video, I spoke about the laryngeal cartilages, the joints and the ligaments and membranes of larynx. And in my last video, I've spoken about the muscles of larynx. And now in this session, I will be talking about the different spaces in larynx and the different compartments that you can divide the larynx into. Now these two are very important short notes that are usually asked in exams. So let's start our class now. So today the first topic I'll start with are the spaces in larynx. Now these spaces, there are three very important spaces that we'll be discussing over here. What do these spaces represent? They represent potential pathways of tumor spread that may have a significant bearing on treatment and prognosis. So this is basically, all these spaces are important from the point of view of tumor spread. So the first space we will be speaking about is the pre-epiglottic space of Boyer. Now as you can see, this space is actually wedge shaped with the point of wedge directed inferiorly. You can see in the picture over here, this is this pre-epiglottic space of Boyer, and you can see how this space is wedge shaped with the point of the wedge being directed inferiorly. Now what are the boundaries of this space? The boundaries are, first of all, is anterior boundary. The anterior boundary is formed by the hyoid bone over here, the thyrohyoid ligament and membrane over here, and the thyroid cartilage over here. So you can see from above downwards, these three structures are forming the anterior boundary of this space. Posteriorly, it is formed mostly by the infrahyoid epiglottis. Infrahyoid epiglottis consists of that part which lies below the attachment of the hyoepiglottic ligament. So this whole part is the infrahyoid epiglottis, and also the quadrilateral membrane over here is helping in forming the posterior boundary. And superiorly, you will see that the hyoepiglottic ligament connecting the epiglottis to the hyoid bone is forming the superior boundary. And laterally, this space is continuous with the paraglottic space, as there are no anatomical boundaries in this region. So these are the boundaries of the pre-epiglottic space. Next, coming to the content, it contains, as you can see in the picture over here, it contains fat, areolar tissue and lymphatics. Now we have to know, why is this space so important? This is because the tumor may spread into this area through small perforations in the epiglottis, or the second route of spread is via the hyoepiglottic ligament. When I have discussed in the anatomy of larynx about the specific cartilages, while discussing epiglottis, I have told you that there are small perforations in the epiglottis present. These perforations may act as a route for spread of tumor into the pre-epiglottic space. Also, it can happen via the hyoepiglottic ligament. Next, let's move on to the second space, which is the paraglottic space, also known as Tucker's space. Now, what are the boundaries of this Tucker's space? Laterally, it is formed by the thyroid cartilages. As you can see here, laterally, the thyroid cartilage is forming the boundary. Medially lies the quadrangular membrane, which is over here, and the conus elasticus. So this is the medial boundary of the paraglottic space. Posteriorly, which is not visible in the image here, posteriorly it is lined by the piriform fossa mucosa. You can see here, this here is the paraglottic space. So the laterally boundary is formed by the thyroid cartilage, medially by the quadrangular membrane and conus elasticus, and posteriorly by the piriform fossa mucosa. And as I was telling you earlier while talking about the pre-epiglottic space, that this paraglottic space is communicating with the pre-epiglottic space anterosuperiorly. What is the content of this space now? This space contains the laryngeal ventricles and the sacules. And why is this space so important? There are three reasons here. First is, tumors may spread extensively in this submucosal space in the absence of any significant mucosal changes. Secondly, the growths which invade this space, they destroy the cricothyroid membrane. And thirdly, the tumors in the ventricle that arise from the ventricle, as I was showing you, this is the ventricle over here. This is the ventricle. Tumors arising in the ventricle, they spread transglottally. Therefore, this has been all about the Tucker's space or the paraglottic space. And the last third space which is important in the larynx is the Reinke space. Now, what is this Reinke space? Reinke space is basically a potential space which is lying underneath the epithelium of the vocal cord with very scanty subepithelial connective tissue. This space is basically a part of layer in the vocal cord. When you come to this picture, you will be able to see this space over here is the Reinke space, this particular layer. It is a part of the lamina propria. As you can see, it is a subepithelial space lying just underneath the epithelium, and it contains loose connective tissue. Now, when you talk about boundaries of this space, above and below they are bounded by the arcuate lines. Anteriorly, it is bounded by the anterior commissure somewhere over here, and posteriorly they are bounded by the vocal process of the arytenoid cartilages over here. So, this is the boundary of the Reinke space. Now, why is Reinke space important? Because when there is edema of this space, it causes bilateral fusiform swelling of the membranous cords, leading to a condition which is known as Reinke's edema. As you can see in this picture over here, it is an endoscopic picture showing the bilateral fusiform swelling of the vocal cords. This has happened due to an edema in this Reinke space subepithelially. This usually happens in cases of smoking or vocal abuse. So, this is all about the three spaces in larynx: the pre-epiglottic space of Boyer, the Tucker's space or the paraglottic space, and thirdly the Reinke space. Now, next we move on to the compartments of larynx. Now, larynx can be divided into three compartments by two pairs of folds. Now, what are these pairs of folds? The upper folds is called the vestibular folds. As you can see over here, this pair of folds over here is the vestibular fold, and the lower folds is called the vocal folds, which is this pair of folds over here. So, these two folds divide the larynx into three compartments. The upper compartment, which is lying above the vestibular fold, is the vestibule. The middle compartment, which is lying in between the vestibular fold over here, and the vocal fold over here, is the laryngeal ventricle. It is this space over here. And lastly, the part of the larynx which is lying beneath the vocal folds is the infraglottic cavity. So, we will be discussing each of them now. So, first compartment is vestibule, which is also known as the upper compartment because it lies above the level of the vestibular folds. Now, what is its extent? It extends from the laryngeal inlet to the vestibular folds. As you can see over here, this over here is the vestibule of larynx. It continues from the laryngeal inlet over here till the level of the vestibular folds. This whole space over here is the vestibule of the larynx. Now, I have discussed about the laryngeal inlet boundaries in a previous video when I have spoken about the anatomy of pharynx, I have described what are the structures which is forming the laryngeal inlet boundaries. Anterior boundary is by the free margin of epiglottis, posterior boundary is by the interarytenoid fold, and on the sides by the arroepiglottic folds. So thus you see that the first compartment is the vestibule of larynx extending from the laryngeal inlet to the level of the vestibular folds. Now coming to the next compartment is the ventricle. The ventricle is the middle compartment, also known as the sinus of larynx. It is a deep elliptical space which is extending between the vestibular and the vocal folds. As you can see in this picture, this elliptical space in between the vestibular and the vocal folds is the space which is known as the ventricle of larynx. Now, there is also a diverticulum known as the saccule of Hilton. Now, what is this saccule? It is basically a diverticulum of mucous membrane which starts from the anterior part of the ventricular cavity and ascends in between the vestibular ligament and the inner surface of the thyroid cartilage as high as the upper border of the thyroid cartilage in some people. Now, this saccule contains a lot of mucous glands which helps to lubricate the vocal folds. You can see in the structure over here that this is a saccule. You can see there is a diverticulum of mucous membrane which is extending anteriorly and ascending in between the vestibular ligament over here and the thyroid cartilage over here. It may extend to the highest limit of the upper border of the thyroid cartilage. Now, what is the importance of this saccule? Importance is that when this saccule gets dilated, it results in the formation of a laryngocele. And secondly, the ventricle and the saccule, they can harbor occult cancers and they may need to be actively inspected during diagnostic endoscopy. So you can see over here in this picture that this is the picture of a normal saccule, whereas on this side we can see that the saccule is distended. When the saccule gets distended, it leads to the formation of something known as a laryngocele. Now, the laryngocele in itself has about two parts. It can either remain internal or it can also have an external component. It is called as internal when it remains within the laryngeal framework. As you can see over here, this dilatation over here is lying within the laryngeal framework. When it breaks out through the thyrohyoid membrane, as you can see, this is a thyrohyoid membrane, it membrane and goes outside to present as a swelling in the neck. That particular part is known as the external laryngocele. So this is all about the ventricle and the sinus of Hilton. Lastly, the third component is the infraglottic part, which extends 1 centimeter below the vocal folds to the lower border of the cricoid cartilage. So next we come to some particular parts about these compartments of larynx. First we'll talk about Rima vestibuli. What is this Rima vestibuli? It is a space which is lying in between the two vestibular folds. You can see in this picture over here, the part which is shaded in green, is the space in between the two vestibular folds. As you can see here, this is the vestibular fold and this is the vocal folds. So the space in between these two vestibular folds is the part which we are calling as Rima vestibuli. Next we move on to vestibular folds. Now these vestibular folds, they are 2 in number, and what really comprises these vestibular folds is something that we will be studying now. They are basically thick folds of mucous membrane which is scaffolded on a narrow band of fibrous tissue which is known as the vestibular ligament. And this is something I have discussed in my video on anatomy of larynx, where I have spoken about the ligaments and membranes of larynx. I have spoken about how the vestibular ligament is formed by the condensation of the lower border of the upper quadrilateral membrane. Now this vestibular ligament has an anterior attachment and a posterior attachment, and that's how it is fixed. So it is fixed in front at the level of the thyroid cartilage. This is the vestibular fold or the vestibular ligament. You can see over here the anterior attachment is at the angle of the thyroid cartilage just below the attachment of the epiglottis, and behind it is attached to the anterolateral surface of the arytenoids just above the vocal folds, vocal process, as you can see over here. Thus, this is the attachment of the vestibular ligament. So, other than vestibular ligament, the vestibular folds also contains a few fibers of the thyroarytenoideus muscle and also some mucus glands. So, this is all about vestibular folds. Next, we come to something known as the Rima Glottidis and the vocal folds. So, what is this Rima Glottidis? It is basically an elongated space between the vocal folds anteriorly and the vocal processes and base of arytenoids posteriorly. As you see over here, these are the vocal folds anteriorly and the vocal process and the base of the arytenoids posteriorly. In the previous picture as well, you can see this this part which is shaded in blue is the space in between the two vocal folds, and this space is known as the Rima Glottidis. Now, this space has a antero-posterior diameter of about 24 mm in males and 16 mm in women. And this region is the narrowest part of the laryngeal cavity. This is very important. Now, this Rima Glottidis can be divided into two parts. The anterior 3/5 of the glottis, which is formed by the membranous cords, is known as the phonatory glottis. As you can see over here in this picture, the anterior 3/5, it is the intermembranous part which is forming the phonatory glottis, because this part is being lined by the membranous part of the cords. And posterior 2/5 of the glottis, as you can see over here, it is being formed by the vocal process of the arytenoids. Therefore, this is basically the cartilaginous part, also known as the intercartilaginous part, and this part is responsible for the respiratory part of the glottis. So, the anterior 3/5 forms the phonatory glottis and posterior 2/5 forms the respiratory glottis. Next, we come to vocal folds. Now, vocal folds, they extend from the middle of the thyroid cartilage angle to the vocal process of the arytenoid cartilages, and scaffolding them is the upper border of the conus elasticus. When we discuss about the histology of vocal folds, we'll see that it is a very layered structure. So, when we come from superficial to deep, there are total 3 layers. So, the first layer is the non-keratinizing stratified squamous epithelium layer. And just underneath this layer, the second layer is the lamina propria. Now, this lamina propria in itself can be divided into 3 distinct layers. As I was telling you earlier, the first layer is the superficial layer, is also known as the Reinke space. Now, this layer contains a fibrous substance with very similar characteristics to gelatin. Next lies the next second layer of the lamina propria is the intermediate layer, which has the elastic fibers, and thirdly the deep layer, which is collagen fibers. Now, this intermediate layer and the deep layer together, they form the vocal ligament. And lastly, the third layer is formed by the main, which is the main content, the main body of the vocal fold is the vocalis muscle. So, when we come here in this picture, you can see the first layer here is the non-keratinizing stratified squamous epithelium, this particular layer. Next comes the lamina propria, which can be divided into 3 layers. The first layer is the Reinke space, as you can see, this particular part. Second part containing the intermediate, containing the elastic fibers is the intermediate part of the lamina propria, and this is the deep part of the lamina propria, which contains of collagen bundles. Now, this intermediate and the deep part of the lamina propria together, this whole thing is known as the vocal ligament. And lastly, the main content of the vocal folds is the vocalis muscle. So, these are the 3 layers of the vocal folds. Now, we will see that this layered structure is actually not uniform in its entire length. Now, where are the places that it's not uniform? So, the first such place is at the anterior end of the vocal fold. At the anterior end, what we see is that there is a mass of collagen fibers which is termed as the anterior commissure tendon or the Broyles ligament, which are connected to the inner perichondrium of the thyroid cartilage and to the deep layer of the lamina propria posteriorly. As you can see in the picture over here, this is the anterior commissure tendon, also known as the Broyles ligament. At this region, you can see that there is a mass of collagen fibrils over here. Next is adjacent to this Broyles ligament, just a little posteriorly, is another mass of elastic fibers which is continuous with the intermediate layer of the lamina propria. It is known as the anterior macula flava. You can see in the picture, this is the anterior macula flava. As you can see, it is a bundle of elastic fibers which is continuous with the intermediate layer of the lamina propria. Next, lastly, third part is a very similar structure again to the macula flava, but it is seen at the posterior end of the membranous part of the vocal fold. You can see over here is the posterior macula flava. So, first is this anterior commissure tendon or the Broyles ligament, second is anterior macula flava, and third is posterior macula flava are the three regions where the vocal fold is not uniform in its length, and it is thicker in these regions. It is a condensation of either collagen fibrils or elastic fibers. Now, why is this important? Because these structures, all these three structures, they actually serve as cushions to protect the ends of the vocal folds from mechanical damage caused by the vocal fold vibration. And at the anterior commissure, the lower edges of the vocal folds form the apex of a triangle via the Broyles ligament to the epiglottis. Importance is that tumors which involve the anterior commissure, they readily leads to involvement of the subglottis. So, we have covered everything about the compartments of the larynx, the vestibular folds and the vocal folds, the two spaces in between the vestibular folds and vocal folds, which are the Rima Vestibuli and the Rima Glottidis. So, that's all for today. Thank you for watching my video. If it has helped you, please subscribe to my channel and share with your friends, and I'll be seeing you next in my next video.